Welcome to Nursing Mantra. Today, our video is related to New Zealand nursing license registration process. Make sure you are familiar here. This is my channel Nursing Mantra. Like this video, hit that subscribe button. Click on the notification bell to get updated informative videos for all healthcare professionals. We can see the step-by-step process to become a registered nurse in New Zealand. So, step 9. Complete a competence assessment program, CAP program in New Zealand. 3 parts in CAP. That is, foundation of theory classes will be there. 2 days classes online also nowadays conducting. So in that, a code of ethics, infection control, guidelines for safety, then a code of health and disability, culture and safety, medication management, treating of Waitangi and Maori health in nursing education practice that is doing in the New Zealand. They are practicing these forms of treatments. Okay, so nursing care plan about 5 steps of nursing process. We have to submit online assessment. Then SBAR communication to the tutor through Zoom applications and all we have to do. Then we have to do the OSCE, okay, objective structured clinical examination, practical and written examination about the medication administrations, then universal formulas, medication formulas, IV fluid formulas like that. There are 4 stations in OSCE. Vital signs station, blood glucose and urine dipstick checking testing will be there. Medication administration section station will be there. Delivering ISBAR, okay, through the phone like that. Then they will give one scenario based on the condition. You can do it all the process accordingly. Okay, so check the scenario. Is it emergency or not? Pretend with a real patient. If you are getting mannequin, you have to pretend the mannequin is a real patient and you have to communicate like that. Then medication administration scenario will be there. Then delegation of care by a registered nurse to healthcare worker. Then OSCE is recorded, full exam duration and events, everything is recorded. And after OSCE, there will be clinical placement will be there. After pass OSCE, 4 weeks clinical placement they are usually provides. So the clinical placement will be in aged care facility, hospitals, schools like that it will be there. Then 8 hours per day or 5 days per week to get familiar with the hospital patients like that. Then your tutor will visit to your hospital and ask for follow-up and write at the end the clinical practice competence assessment form for the registered nurse's scope of practice. So you are investing a huge amount for CAP. Now I am talking about how we can get fund for the CAP. So internationally qualified nurses CAP fund, like that you can type in the website, New Zealand Nursing Council website, you can see the details of CAP fund, how they will provide you the CAP fund, how to apply for the fund. To register your interest in the fund, you first need confirmation from the Nursing Council of New Zealand that you need to complete a CAP course. That initial confirmation you will get, right? So with that confirmation letter, we have to provide to the New Zealand Nursing Council. Okay, so a start date for the course. You will need the information before you fill out the form. When your form is complete, you have to send it to the nursing contracts at tas.health.nz. So you have to send all these forms to this mail ID. So reimbursement of cost will be considered when internationally qualified nurses have completed the course and can provide evidence of the following. Like successful completion of a competence assessment program CAP offered by provider accredited by the New Zealand Nursing Council. Then registration from the New Zealand Nursing Council, a confirmed offer letter of employment that is in a direct patient facing role such as hospitals, aged care or GP practices or mental health and addiction centers and all, you have to provide the job offer letter. Required work visa to work in New Zealand. Then these all documents it is required. So what funding is provided? The fund applies to CAP that begins from 1 August 2022. Before that we will not get. Okay, after 1 August 2022 for the CAP programs we will get the refund. The maximum amount the fund provides is up to 10,000 New Zealand dollars per applicant. So funding will be prioritized for nurses who have secured full-time employment. Nurses intending to work part-time, they will receive prorated financial assistance based on how many hours they are working. For example, if an overseas nurse undertakes a cap at the cost of New Zealand dollar 8,000 and is working for 20 hours a week, the amount they can claim is New Zealand dollar 4,000 only. Okay, so this is the things regarding the fund of the cap. So important updates about cap in 2024. That means major changes are going to happen in the beginning of 2024 that we all are waiting for that. That is the closure of the cap. Okay, that means the competency assessment program, they are closing it. So they will start online exams and OSCE, small education modules, which is similar to the UK processing and Australia programs. Okay. So I am assuming that it can be like NCLEX exam or CBT exam, separate exams, or similar to NCLEX, any online exam which you can be written from your country. I am assuming like that. Okay. So, and after reaching New Zealand, there will be one day exam for OSCE in UK and OSCE exam is there. Same like that, maybe. So, OSCE pre-exam training you will get from the New Zealand. Regarding new changes, there is not much updates in the website. Then step 10. So, now you completed the CAP program. Then what is next? That is do medical. You can check in the site. Find a physician. General medical physician you have to select, then find a doctor near to you. So you can see the approved panel of physician in New Zealand, you can check, and the type country where search with your place. So medical examination fee that will cost 540 New Zealand dollar, around like that it will cost. So after completing the medical, step 11, send the CAP assessment report to the Nursing Council. To the Nursing Council of New Zealand, a report for competence assessment program for internationally qualified nurses registration. Example, the scenario of the competency result. Scenario, competency result, everything they have to send. This report will be sent to the Nursing Council for registration. Step 12, you have to obtain annual practicing certificate from the Nursing Council. So once you registered, you will be asked to apply for an annual practicing certificate. This entitles you to practice a nurse in New Zealand. So annual practicing certificate that costs you 130 New Zealand dollar. Step 13, seek for employer. You can seek for an employer with your annual practicing certificate which is issued by the Nursing Council of New Zealand. How to find job sponsors or job search website. Here I am giving some website details. I hope this website will be having the nursing jobs. seek.co.nz. trademe.co.nz. Adsuna, New Zealand, you can search the website. Then Jora, New Zealand, you can search the website. Indeed, New Zealand, you can search. LinkedIn, jobs in New Zealand also you can search. Step 14, you have to get accredited employer work visa. So accredited employer work visa details are mentioned in the New Zealand immigration website. You can check whether it is accredited or not. For getting the visa process, what are the documents required? That is offer letter from the accredited employer at least 30 hours per week. Your employer must pay you at least the New Zealand median wage unless your occupation is exempted. You must have necessary skills and qualification for the job. Meet the health and character requirement. These are the steps which is involved to get nursing registration in New Zealand. Now we can see the approximate amount which is involved in this process. For IELTS or academic fees, 175 to 195 pound depending on the location, and OET 589 Australian dollars. That is duration almost 1 month. You will get the result like that. Okay. Then CGFNS credential verification services fees, that is 300 US dollars. Then all university and licensing council verification fee, that is depends on your council, okay, from your colleges, from your council, around 300 USD altogether. So if you have more documents, the amount will be more. Then New Zealand Nursing Council application and a processing fee, that is 485 New Zealand dollar. Cap fee 8,000 to 12,000 New Zealand dollars, that is refundable around 10,000 New Zealand dollars, you will get the refund. So international criminal history check, the fees is 149 Australian dollars. Medical examination fee, that is 540 New Zealand dollar. Work visa application 495 New Zealand dollars. Other related costs set by each provider, that is included. Translation fee, if your documents are not in English, for original documents translation, there will be fees will be there. Police clearance certificate, which all are the country, from each country where you lived differs individually, the amount will be differ. Then visa process fees depends on your dependence count and the area where you selected. Hotel booking fee, accommodation fee and all fees, okay, it will be changing. Show money in the bank, you have to show around 18,000 New Zealand dollars. Then travel expenses to reach the cap centers, you have to be keep in your hand. Then daily living expenses once you reach in New Zealand, about 15,000 AED you can keep in your hand, that can be used until you get the job. Then air ticket, you and for you and your family, air ticket fare, based on the ticket fare, that fees also will be changed. I hope I covered almost all part. If any information is wrong or to be added to this, kindly comment in my channel. If you found this deep dive video is very super helpful, write your love in the comments to